Okay, it's 1 o'clock. I'll call this meeting to order and establish that we do have a quorum. Alrighty, so the first order of business is to review the agenda. And I'd like to ask for any additions or changes.
No changes, Madam Chair, but did want to point out that the original agenda and packet that went out via email and also via mail was updated. And so the agenda, the corrected or the updated agenda included an action item, the sign-on letter to the Bureau of Reclamation. So those of you that are online, if you pull it up on the website does have the updated packet for you. In case you have the one that was mailed to you in front of you, it's the old one.
Thank you. Alrighty, anything else? Okay, well then we can move on to the minutes. If you all would take a minute to review the minutes and let me know if you have any corrections or additions, please.
This was Sandy's first minutes with us, so feedback welcome.
Thank you, Sandy. Yes. Okay. Hearing none, the minutes are approved and we can move into introductions. So I'd like to welcome the employee of the quarter and the new staff.
Excellent. Madam Chair, members of the board, I'll start with new staff. And we do have a couple of new staff, but only one that was able to join us today, and that's Sandy. So I wanted to, last month we missed an opportunity because she left the board meeting before we finished up at the very end. And we missed a chance for you all to meet her and see that she is now our new administrative support supervisor. And so she has replaced Jolene, and so that's the position that she is in for the department. We did change her position just slightly. Jolene wasn't a supervisor, and so when Jolene left and we went to hire the position, we decided to make this position a supervisor of the admin support team. And so far it's been working really, really well. I think that our admin support team is getting the necessary support they need so that they can support the rest of the department. So we are very excited to have Sandy with us. And if you would like to take a couple minutes and just introduce yourself. And
yeah, so as we know, I'm Sandy Whittington. This is my first opportunity to be a part of public health. I'm very excited to have joined the group. My background is mainly in financial and real estate. So this has been a really great opportunity for me. And I feel like it's a great thing working together with the team and getting to know all the pieces and parts. So I'm very excited.
Yeah, we're great. Welcome. So happy to have her. She has an excellent skill set that goes above and beyond what our expectations were when we put out the call, the position description and the recruitment. We are getting much more than we asked for. So very happy about that. And then we do have a couple of new staff that we'll introduce to you in January. They weren't able to be here. Rachel is our new suicide prevention coordinator, and Valette is our new substance misuse coordinator, prevention coordinator. But again, they weren't able to be here. So when we do this again in January, you'll get to meet them. And so that then brings us to employee of the quarter. I'm super thrilled, and this is always really exciting for me because it's really an opportunity to share with you staff that really do go above and beyond for the health department and for this community. The staff in this department work so very hard, and I would say that every single one of them deserve recognition and award every day because they show up and they work hard and they do their very best with the resources that we have to serve this community. But on the quarterly basis, we do a nomination process, and it's a peer nominated process that we have. And so this quarter, I'm pleased to announce that Nina Heltzinger is our quarter award winner. She is our licensed establishment program supervisor. So she supervises the 3 sanitarians that go out and do restaurant inspections, pools, spas, public accommodations, trailer parks. So they are a small but mighty team. They do so much for this community. And Nina came to us 2 years ago now, Laurel.
I think it's longer than that.
Has it been maybe closer to 3 years that she joined the team?
Yeah.
And she has just been an incredible leader within this department, not only for the licensed establishment team, providing the necessary support that they need to do their jobs well, and the leadership to support them, but she has really jumped into many different aspects of the work that we do here in public health. She has a real passion for wellness, and so has really contributed lots of great knowledge and some skills even to our overall leadership team within the health department, but also to the broader staff. She has a real passion for nutrition, and she's done a really good job of helping us learn some stress management and balance and taking care of ourselves. And so really do appreciate, and she's not here with us. She's on vacation, or is she? Okay.
She's on vacation.
Yeah. So she didn't get to be here with us either, but wanted to take a minute and let you know how much we really do appreciate her. And Nina, you're her direct supervisor. What would you add?
She has amazing leadership skills. She can listen well and hear what needs to happen and bring it together into things that pull everybody together into the decision making. And so she's an amazing resource.
She takes a real collaborative approach to the team. And so just really lucky to have her. And since she's not here, we'll pass on any comments that the board has. So
It's great here.
I'd like to say I do appreciate Nina. I've had the opportunity to collaborate with her on a few things public water supply related. So she reaches out to all the cross departments to make sure everybody is informed of what they need to do as a licensed establishment. So I appreciate that. Congratulations to her.
yeah, thanks, Lisa.
Okay, all right, thank you. Great. Okay, so the next order of business is our action item, the sign-on letter to the Bureau of Reclamation.
Thank you, Madam Chair, members of the board. I have Beth here that will give a little bit of background, but in your packet on page, on page 8 of your packet is the letter that's been drafted to be signed by myself as the health officer, Bree as the board chair, and then Andy Hunhausen as the chair of the Lewis and Clark County Commission. And then following that is a resolution from 1999. So this is an old problem that's lingering, but that gives you a sense of the involvement that the board had back at that time when the situation had been identified. And so Beth will give you a little bit more background, and then we can definitely have discussion and questions. But thanks,
Thank you.
Beth, for jumping in.
Good afternoon, Madam Chair, members of the board. Beth Norberg, Environmental Program Supervisor. And today I have for your consideration, like Jen had mentioned, a letter that's been drafted at the request of the Canyon Ferry Sewer District residents. The district is comprised of residents on the east and west shore of Canyon Ferry Lake, and it was formed a number of years ago with the intention of finding off-site wastewater treatment locations for the cabin sites. On Bureau of Reclamation lands. So what they want to do is these cabin site owners want to find off-site locations on BOR land so they can have a series of multi-user shared type wastewater treatment systems. Sorry, I'm struggling with my lingering cough. So there's a long history with these, so I'm going to be brief. But in the 1990s, the Bureau of Reclamation sold off 265 of their seasonal cabin sites. So these were just like rental properties that the Bureau owned. And they sold them off to the private residents out there. And that is, like I said, East and West Shore. They were generally, the lots are very small. All of them are less than 1 acre in size. So there's not a lot of option when you try to site a well and a septic system out there. We did work with the residents in the late 1990s and 2000s, and we upgraded a number of those septic systems, replacements, retrofits, upgrades. That was a condition of the sales. So Bureau of Rec said you need to make sure these septic systems are legally permitted. So that was a condition of that, and we went through and did a number of those. In 1999, Brenda mentioned the Board of Health resolution. We know this was over 20 years ago, but that was a resolution. It was the intent. The board was saying, listen, we're not going to do variances for septic systems that don't meet the minimum standards unless it's a holding tank. We're not going to do non-conforming septic systems out here. We're going to have these permanent offsite solutions established. Let's move forward with that. We're urging BOR to work with the residents out there, and we support that. So that was the intent of that Board of Health resolution. However, there's been little to no movement with really establishing these lands. And now that we have septic systems are all upgraded and installed in the 1990s, that's 24 years ago that this happened. Those systems are now going to need to be replaced. So for example, just to give you guys a little background, some of you may have been here, I'm not sure who is still here with the Board of Health, but in 2021, we did a holding tank variance for a resident out there with the intent that that variance expire after 3 years because the offsite system was supposed to be available to him to connect. And now that variance expired this last September, and there's nothing happening there. We don't know when this is gonna happen. Just this week, I received a call from an original resident that did upgrade his system in 1999. He does not have a well. He hauls water, but he has this septic system. He really wants to drill a well, and there's nowhere for him to drill a well that can meet the minimum setbacks. And he's asking me, "Do you think I can get a Board of Health variance for that?" And I don't know, right? So these are questions, or these are gonna be hard decisions as a Board of Health, as these systems start to potentially fail again, when we don't have an option for them and no plan by the Bureau of Reclamation to be able to have lands available and move forward with that process. Also, another example, residents on Little Hellgate Road, about 7 lots, have gone through engineering. They've obtained individual septic tank permits so that they can all connect to a multi-user system on BOR land, but that has fallen through now, and they don't know where they're gonna go with this. So because of these delays, this is why the residents out there reached out first to Commissioner Hunthausen and myself with the health department, just asking, hey, is there anything you can do? Is there anything we can do to help kind of move this process forward a little bit? And while there's nothing we can do regulatory at this point, they're a sewer district. This is their relationship between the BOR and the residents in the district. We can kind of help hopefully move that needle along. But listen, this is a really prime resource for us in Lewis and Clark County. We have aging systems out there, and we really need to move forward with finding these options and making sure we can have these permanent solutions available. So with that, the letter you have is kind of explaining or kind of trying to help the residents, just offer support to them. That's all at this point we're asking for. So, yeah, and welcome to answer any other questions, because it's a lot.
It's a long history.
I have a question,
Yeah.
if I may. My family had a cabin out there, and I know a lot of the cabins are on hills like that, so it's really hard to get a good septic system in there.
Yes.
We had an outhouse,
Yes.
that's what we used. But if we sign this letter, it's just in support of the homeowners. It has nothing to do with the BOR, right?
No, it's just in support of the homeowners to say, hey, listen, BOR, they have been ready. The residents out there, years, they formed their district. They've been paying into this district. They've been paying fees to BOR. They want to see some sort of movement happening. And so we're of course in full support of that because we don't want
Right? Contamination.
contamination.
Yeah. Is that a legislative thing that needs to go forward?
No, it's not a legislative thing. How I understand it, there's a federal review process. And so they're now claiming that they have to go through this additional procurement type of contract review in order to turn those lands over or make those lands available for the offsite wastewater treatment systems. And no clue on how much of a delay that's going to be. And so they're just very frustrated at this point.
Well, one other question. So the lots are like an acre or whatever, half acre. So how much of the BOR extends around those lots? Is that what we're dealing with?
Yes, it's
Okay.
it's going to be the immediately adjacent BOR lands. There's some smaller lots that have been approved for some of the lots, but the majority of them are going to be on pretty large swaths of BOR land. So it would be done with easements. I don't know off the top of my head how many acres that is total,
I'd have to look at it.
but they're all adjacent to it.
Okay. Okay.
Thank you. Any other questions or discussion?
I think the letter's relatively informal, I guess, in the sense that it's a letter. Has there been any contact between the health department and Bureau of Reclamation on an even more informal level so far? Like, have there been any conversations?
Yeah, well, the last conversation I myself personally had, I did attend a meeting between the BOR and the residents last year. We were supposed to have another meeting in, I want to say, end of August or first part of September, and they canceled that meeting. So they've tried to bring the county in on some of those conversations. We're not, and some of those talks, it's more, this is how we permit the systems. This is what we're going to do to review these systems. So from that regulatory standpoint, we have done some site work out on some of these lots as well. Test holes, looking at soils, and doing some of those things too, but that's as far as it's gone.
I would just comment that I think, maybe adding a sentence in the second paragraph that says in 1999, the Board of Health issued a resolution urging BOR to look at viable outside options, and then sort of just pointedly saying like, there hasn't been any progress. Like, I don't think that point is said. And given the length of time, I think that might be useful.
Great,
Thank you.
For that. Yeah, definitely.
Yeah, absolutely.
Anybody online have anything they'd like to add? Questions, discussion? Okay.
I certainly agree with the comments that just made, giving it a little more urgent language that, come on,
Let's
get off the dime. We got to do this. So.
Thanks, Commissioner Payne. Okay. Any other comments from online? Okay, well, I would entertain a motion if there is one.
There are comments online. I don't know how to get to them.
That'll be public comment. Oops, I'm sorry. Yeah, so when we get to public comment, we can encourage.
Okay.
that.
Okay, great. We see you, Commissioner Shirtliff wanting to say something, so I'll welcome that in just a couple minutes. So I call for a motion if we have one.
Yeah, Madam Chair, move to approve the Director of the Health Department to sign on to the letter to the Bureau of Reclamation with sort of the additions that we discussed.
Thank you.
I second it.
Thank you.
May I add, the motion was for me to sign.
Oh,
The
I'm
request was
sorry.
for the board chair to sign.
The board
Yeah,
chair
yeah.
and the director. I'm sorry.
Thank you.
Is it
Thank
both? Yeah?
Yeah.
Okay,
Yeah, thank you.
sorry.
Perfect, thank you. Do you second that as well? Did you hear that? Okay.
Yes, I do.
Okay, thank you so much. And now if there's public comment on this issue, we'd love to hear from you.
Ask them to unmute.
Okay, you should be able to talk now. If I
Hi,
did it right.
everybody. Hey, everybody, this is Andy Shirtliff. Thank you very much for all the work you're doing. And I missed, someone had come in and talked to me over about something else, and I wasn't able to hear. So I don't have public comment on this specific issue, but just thanks for all you're doing.
Appreciate you being here. Thank you. Okay, not seeing any further public comment. Any further board discussion? Okay, with no further discussion, I'd call for a vote then. All in favor, for those voting online, please turn on your cameras for your vote. All those in favor, please say aye.
Aye. Aye.
Thank you. Any opposed, please say. Okay, hearing none, the motion passes. Great. Okay, so moving into board discussion. Fiscal year 25 Q1 finance report by Heather.
And Heather and I are going to tag team. I'll start out. So in your packet, which now I don't know, depending on what packet you're looking at, it's pages 14 and 15 in the updated packet. What we have here is your Q1 finance report. And so just as a reminder, our fiscal year starts July 1st, goes through June 30th. So the numbers that you see in this finance report represent the first quarter of the fiscal year 25. On this first page of the report, we have a revenue, the revenue that we have collected at this point for the first 3 months of the fiscal year. Of note, it shows that we are 6.53% of the budget collected. A good chunk of our revenue comes from tax revenue, and that tax revenue is not collected until November and then again in May. And so you don't see any tax revenue collected as of the first quarter of this fiscal year. So that's why our revenue percentage is low when you compare it to the budget. And then the second section down on that same page is an explanation of our expenditures associated with personnel. So if you scroll back up, Laurel, to the table at the bottom. Yep.
You picked the wrong person to do this.
So this is the personnel shows that we are, although 25% of the way through the fiscal year, we are 27% of the way through payroll. It's because we get paid every 2 weeks, which results in 2 extra pay periods in a fiscal year. We had one of those extra pay periods in the first quarter. So that equates to a 27% of the way through payroll. And we have spent 26.99% of our personnel. So far, we are right on what we had budgeted. And then on the next page, you will find these are expenses associated with our operations. And it gives you all the detail. But what I'll do is bring your attention.
I have a question.
Yes, ma'am.
Back on the year-to-date actual expenditures, it points out that there is a CIP transfer of 150,000 CIP capital improvement something. So can you tell me, where that money has been spent or where it was transferred to?
So this is our CIP. So we budget to infuse funds into our capital improvement plan. to
Yeah.
cover items that need to be replaced. For
Yes.
example, vehicles or our large copier. And for this fiscal year, I think we had one major expense that needed to come out of our CIP, and that was our big copier. I'm looking at Heather to see if there was anything else that you remember. So the amount that we contributed into our CIP for this fiscal year was more than we normally would do, but it's because we had to do a catch-up year. We did not put as much in fiscal year 24 as we needed to. And so that was caught for fiscal year 25. We needed to put more into our CIP. And so that's what that represents, is the funds that we intend to put into our CIP for the year. And then any expenses, you'll see those come out on that line item. We haven't had any at this point.
Okay, and this is helping to educate me. I'm sorry, I'm not more informed, but this is how I will get to be. So these expenditures are not included in the actual expenditure table because they're being transferred into a fund so you can buy your new copier.
Correct.
They're
Yeah,
still under the control of this department.
Yes, so our CIP is a separate fund outside of our normal budget.
Yes. And is that still, is that included in the budget for the Department of Health?
Yes.
Okay, so when the county commissioners look at it, we see that you are saving and planning so that you can buy more equipment.
Yes.
Okay.
Yeah, we have specific items within our capital improvement plan that we are planning for replacement.
Okay, thank you. I appreciate it.
Yes. So then on the next page, so this, I guess, the page that we're on. So thanks, Laurel. Again, this represents the expenses associated with our operations. And then down at the bottom, I'll just bring attention to, Laurel, you may have to, for those in the room, you may have to move the participants out of the way because the numbers I'm referring to are at the very bottom of.
Okay, I can make this happen, I promise.
Yeah, and for those that have it in front of you, what I want to bring to your attention is that we have spent 30% of what we budgeted, which is slightly over where we are in the fiscal year. The biggest reason for our overspending at this point in the fiscal year is our vaccinations. So we purchased an enormous amount, thousands of dollars worth of vaccinations in the July, August, and September timeframe in preparation for vaccine season. So respiratory illness seasons we're right in the midst of it, and we purchase all of those vaccines in advance of the clinics that we offer October, November, December. So the revenue that we get from providing all of those vaccines, you won't actually see those until probably January. So we make a huge purchase of vaccines, and then the revenue trickles in over the course of the respiratory flu season or respiratory illness season. At the bottom, you'll see that our ending so kind of in the middle of the spreadsheet, towards the bottom, ending cash is $574,170. And in order to meet our 90-day reserve, we need $673,356. So we're short of our 90-day. So we're at a 77-day reserve right now. But also please take into consideration that our revenue hasn't hit for the first part of our tax infusion. So that tax revenue doesn't hit until November. So if you compare where we are today at 574,000 to the number that's right under the highlighted amount or the highlighted fund balance as of last year,
Hmm.
September, we were at 157,000 this time last year. So we're doing much better. Our financial situation is much better than we were last year.
Adrenda, under the right cash flow column, it says ending cash. Does that say non-reserve?
Unrestricted.
Non-restricted.
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 Oh, okay. Thank you.
Yep, we do have a small restricted account for our breast and cervical cancer program. They receive donations that are specific to that program, and so they're put into a restricted part of our overall budget and can't be used for anything except for breast and cervical cancer work. So the unrestricted is essentially the funds that are available for general use by the health department.
Thank you.
Yes. Any other questions?
I have a question on the vaccines.
Yes.
So the flu vaccine is 50,000, the COVID vaccine is 65,000, travel vaccines are 40. What's the difference? Why is there such a fluctuation in the COVID vaccine being so much more expensive than, say, the flu vaccine?
That is what we have to purchase them from the pharmaceutical companies. And we get a really good rate. So
are you mandated by what organization is mandating you?
We are not mandated to do any vaccinations. We, as a health department, it is part of our mission to do vaccines. And we do vaccines primarily for those that don't have access in other areas. So vaccines, as we know, are available pretty widespread. And so we only really do vaccines for those that can't get them anywhere else. And then we also have the vaccine, the program for uninsured, underinsured, and kiddos. And VFC, thank you. The VFC program is, but those vaccines are actually given to us for free through the state program. And then we're able to administer them free for those that don't have ability to pay. But what you see that we've purchased, those are vaccines that we anticipate actually using through the cold and flu season.
So they're voluntary. Are they voluntary?
Voluntary, yes. We choose to run a vaccine program through the health department. Yes, it's part of our mission.
Can I also say something else? Any vaccines that they may not use during a year, they also have the ability to return some of those and get a partial refund. So technically the amount of flu that you see that we paid for is actually more than that because we had like a $20,000 credit from the prior year that they returned. So they do have that option too.
Thank you. Any other questions?
I have another question.
Yes, ma'am.
Okay, so you buy all of this vaccine at the beginning of the flu season in the fall. You know you don't have enough cash on hand. What do they just extend credit?
No, we have cash on hand.
I thought you went over budget on this.
Just on those particular line items, the budget overall is not overspent. Those line items, those line items are impacting our overall budget because we purchase them all at this time of year. And then the revenue then comes in.
Okay.
Trickles in over the next 3 months.
Can you
offset the cost?
Could you put the document you've got on the screen? Could you scroll it up to show me what line it is that these the vaccines where you are paying for them?
More.
2.2 is like,
Right.
there you go.
There we go. So it's line 22.24 is your the flu vaccine purchase.
Oh, okay.
And COVID vaccine is 22.25 and travel vaccines are 22.27.
Thank you. That's very helpful.
Okay.
The copy I have is very small print, but I can, guidance, I can do this. So thank you.
So by the end of the year, that will kind of all balance itself out, right? Because the purchase happened now, but we won't be purchasing anything more for the rest of the year.
And what's kind
Okay.
of our return on investment? Like, like what's the revenue we expect per, different types of vaccine? Like we spend or we spend $50,000 on flu. How much in revenue do we expect in return? Is it
We-
about equal or is it?
It has
much
to
more?
be. We
Oh, it
are
has
not,
to be.
yeah, because we are not making money.
Oh,
We are
right.
covering our costs. Yeah. We are not a for-profit,
Yeah.
so we cover our costs.
Okay,
Yep.
so it should be balanced.
Yep. So whatever we charge is just what it costs us to provide the vaccine.
Is that mandated?
We, as a governmental entity, we're not here to make money.
Gotcha.
So we are here, we're here to provide a service,
Mhm.
and we cover our cost.
Okay.
And there for a while, we weren't covering our costs,
Right.
but we have now adjusted the fee that we charge
Mhm.
so that we are covering our costs. There for a while, we were not.
Okay.
And
That's
our
kind of what I was
tax
trying to
revenue
figure
was backfilling,
Mhm.
and that of course, didn't make sense. So now the insurance companies are paying for what they need to be paying for, and then, it's a wash essentially.
And is
At the end of the day, the purchases that we make will be offset by the revenue that we pull in.
I mean, obviously, at least at this point in time, this is a bigger part of the budget. I think it sounds like we all have some question. Well, it sounds like the vaccine program in general is very much sort of like discretionary within the department as far as, there aren't regulations or anything.
Right.
Would it be possible maybe at our next board meeting to have like an overview of the vaccine program, just to see like, what data you look at to predict like what amount of vaccine or how you choose what types of vaccine? Like, obviously it looks like you haven't spent any on Hep B, but you have flu and COVID, like just an overview of how you predict kind of quantity, but also like what vaccines you choose and why, and how you make those decisions, because it is a large part of the budget. And I think that's probably, it sounds like we all have a lot of questions maybe about that, aside from budget as well.
Excellent. Yep. We certainly can do that.
Thank you.
Yes.
So there would be a loss though on the ones that you didn't charge for. I mean, you can't help that,
Mhm.
but just to make that clear,
Yes. And
you do get a partial credit, but there is a loss there.
yeah, and it's hard to predict.
Yeah.
And so we do the best we can based on last year's demand. I think we look at the last 3 or 5 years even to see what the demand has been, so that we place an order that will meet the demand, but it's not perfect.
Yeah.
Mhm.
Thank you for that discussion. I think it's all really interesting, especially as we think about like Safeway making it much easier to go get your shots there and Walgreens and stuff, and how that's maybe impacting the health department's program, things like that. So
And it has.
thanks for that suggestion.
Yeah, I would say that the availability, a wide variety of locations to receive vaccinations has, but in a good way. And it just means that vaccines are now available pretty much anywhere that you need them for convenience to the residents of the county. And so really, we have scaled our program way back because of that.
Okay.
Yeah.
Thanks.
Yep. Any other questions on our Q1 financial situation? So just in summary, we really are doing very well. We're at a 77-day reserve, and that's before the tax revenue comes in November.
Thank you. Good job.
Yeah.
Way to get that reserve back up.
Thank you. Yes.
I know that took a lot of work.
Well, and part of what contributed to that is that we ended the previous fiscal year in good standing. We underspent our budget at the end of fiscal year 24. Our revenue was a little higher than we predicted. And so we started out fiscal year 25 in a really good place. And so the goal is to maintain that and continue to build that reserve and make sure that we have adequate reserve.
It's probably important because we don't know what's going to happen with property taxes.
Correct.
In the future.
Yeah. Yes. Yeah. I think Frank is the county's finance officer, and he's the one that predicts that for us and gives us the numbers to put into our budget. And yeah, that, it is volatile and depending on what will happen in the legislative session. And yes, so.
Okay, great. Shall we move on? Okay, wonderful. Well, then up next is our training from Laurel on our variants to regulations.
All right, now where did it go? Oh, I see. Didn't expect that. I was going to say, I promise I'm better at PowerPoint than I was at doing the other, but maybe I can't say that. So thank you for having me, Madam Chair, members of the board. I'm Laurel Reek. I am the Environmental Health and Disease Prevention Administrator. I have the longest title in the health department. Today, I'm providing you with information on the regulations and rules that govern how we do our variance hearings in Lewis and Clark County. In your board packet, I have provided you with a number of resources so that you can look back on things after this meeting if you have questions about what we need to do next on variance hearings. So we have Board of Health approved on-site wastewater regulations. The on-site wastewater program at Lewis and Clark Public Health is designed to protect water resources, as well as by working with property owners to ensure properly sited and designed septic systems. A properly sited, installed, and maintained septic system will protect surface and groundwater supplies, the public's health, and private property investments. Not all sites are able to meet the on-site wastewater system or septic system minimum requirements as specified in our local regulations, in our DEQ design standards. DEQ is Department of Environmental Quality, as well as our Montana administrative rules. It can be especially hard for homeowners that need to replace a failed system and the site cannot meet the minimum requirements of the current regulations. There are many reasons why sites wouldn't meet the requirements. Some properties are located in areas where they have shallow or unsuitable soils, such as those found with silty clays or gravelly soils and shallow bedrock. These all have a negative impact on the treatment of sewage. Some lots are too small to maintain setbacks. And groundwater can be too shallow. And you can see that in the picture that was provided to me by Valerie, where the water is actually seeping in where that arrow is. And if that hole were to stay there for long enough, it would actually fill with water to that level. Also, it can be too close to surface water or floodplains. In recognition of the fact that not all property is ideal for a septic system, the law allows property owners to request a variance from select requirements of the rules or the law. However, certain criteria are required to be met in order to authorize a variance. And I have included that on page 24 of your board packet. It's just a list of all of the criteria that's needed. The variance process begins with a request from an applicant. If the applicant has applied for a permit and the permit is denied because the property can't meet the requirements of rules, the applicant can request a variance. Applicants bear the responsibility of filling out the variance application forms and providing accurate information and proving that their proposal will be protective of human and environmental health. In some cases, this can be very challenging and may require the assistance of an engineer or a consultant. Staff sanitarians do not design systems or solutions for applicants. Our public health staff does evaluate properties using a site evaluation process that identifies suitable locations for septic systems. When they have exhausted all the potential solutions, they then identify when properties cannot meet the requirements outlined in rule. They take the time to clearly communicate to the applicant and define processes to apply for a variance. When the application is submitted, staff will complete a technical review of the variance application. And they'll compile a staff report with the submitted information and the site evaluation, which summarizes why the variance is being requested, what facts are pertinent for consideration, what the applicant is proposing, and whether the proposal will be protective of public health. Supporting documents are included in the variance packet that are given to the board and may include maps, groundwater information, and floodplain information. The staff will also provide suggested conditions for the variance. And they're responsible for scheduling the hearing, for presenting the staff report, for answering hearing officer or board member questions, and providing guidance to the applicant in navigating the administrative requirements of the hearing. It can be overwhelming, so they are there to help them through that process. After the hearing, the staff will write up the findings of fact, conclusions of law, conditions if there are any, and the acceptance of variance documents that the applicant must sign. A variance will be considered when the requirements would result in undue hardship to the applicant, or if it's necessary to address extraordinary conditions that the applicant could not reasonably have prevented, or there are no alternatives that are reasonably feasible. In addition, the variance request is not more than the minimum needed to address the extraordinary conditions. The criteria document that I just was telling you about is used to show that approving the variance cannot contaminate any actual or potential drinking water or contaminate state waters. It will also show that the variances cannot cause a public health hazard as a result of access to insects, to rodents, or other possible carriers of disease to humans. It also has to be inaccessible to persons.
I'm on a Board of Health meeting. I'm listening to the Board of Health. What?
Can I ask that everybody please mute their line? Thank you.
I forgot what I said last. So the variance cannot cause a nuisance due to odor, unsightly appearance, or other aesthetic consideration. Recent variances have included two different processes within the Board of Health. First was a public hearing at a full board meeting. The second was a public hearing in front of a board-appointed hearing officer. And at this point, that's Lisa Kaufman. The Board of Health has very specific responsibilities. The process for hearing, for a variance hearing in front of the board is located on page 26 of your board packet. It's an itemized list of what needs to happen in that hearing. The board role is twofold. First is to ensure that the on-site wastewater treatment regulations comply with state requirements and that they are protective of public health. They need to ensure that applicants have been given an opportunity to request a variance and to be heard in a semi-formal hearing following the process that is outlined in rule. And the rules for the hearing are on page 22 of your packet. The hearing is designed to be a forum to present testimony, collect evidence, and allow for public comment. The steps are formal and designed to ensure that due process is allowed to the applicant and all evidence is presented and evaluated. If the final result is contested, either by the applicant or by a member of the public, the request may be appealed to the Montana Department of Environmental Quality or to the courts. Having a consistent, well-documented process ensures that the evidence will support any board decision. If the variance is complex, the whole board should hear the request. The chair will conduct the hearing and board members who hear all the testimony will consider the evidence and vote to approve or deny the request. Each variance hearing can take an hour or more. So the board decided in the past to implement a hearing officer process that to allow sufficient time for other board business. These have been outlined in our local rule, our local on-site wastewater rule regulation, which is on page 19. And the hearing officer process is found on page 28 of the board packet. The hearing officer conducts the variance hearing using the semi-formal hearing process, and staff are available to help guide and direct the flow of the hearing. The difference with the hearing officer is that the final conclusion is delayed until the next Board of Health meeting. The hearing officer identifies the time and place of the next board meeting for the applicant during the hearing. After the hearing, the hearings officer will provide written findings of fact as presented in the hearing, provides conclusion of law, which satisfies all the criteria required to consider a variance and protects public health and the environment, and then provides a recommendation to the board for action. The full board then may either ratify or not ratify the decision. The board does not rehear the variance, and no new testimony can be presented outside the hearing itself. One of the board members at that time will make a motion on the recommendation, for or against. Another will second, and then the further discussion is invited by the board. The chair will ask for public comment, and the applicant can make public comment at that time. And then you take action on it, you vote on it. So with that, I've presented a lot of information in a very short time with a lot of pages of documentation to help sort it out. But I'd be happy to answer any questions. Or Beth will help me.
Madam Chair, if I might, what prompted, I asked Laurel to prepare a training for the board because last month there was a hearing that came to the full board. And I felt like we were a little remiss in not providing the board with the criteria. That is something that during a hearing and with the hearings officer, staff has the form that's in your packet, the criteria form that's on page 24 of your packet. Staff typically has that in front of them. And as the hearing is happening, there are notes being taken. And then there is the hearings officer, so Lisa will prompt, have we met the criteria? And I realized that when the variance came before the full board, we were online. Laurel had the criteria in front of her. She was taking the notes, but you all as board members didn't know that that was happening. And so I thought that it was really important that we take time to make sure that the full board not only understand the process by which either the variance is being heard in front of the hearing officer or the Board of Health, but also kind of make sure that you had that criteria in front of you so that you could also see what staff are looking for when the hearing is happening. So if Laurel would have identified while she was taking notes on the form that's outlining the criteria, if she would have identified something that wasn't being met, she would have prompted that during the meeting. But everything was met. And so documented that things were met, and you went about your business. You had the discussion, you had the motion and the second and the vote. All was well, but I thought it was really important that you all knew that that was happening and to kind of put that out in a more transparent way for you all to know that that's the process that kind of was happening behind the scenes that wasn't seen by the board at the last meeting. So that was part of what prompted the training today.
I left that meeting. I had one burning question, if I may, please. The water quality people had okayed that variance for the Vincelli's, but then the hearing officer, is that true? Was Lisa the hearing officer at that point? She came in and said that she had rejected it. And I asked her why, and she said because that's not the way it had been done previously on the lot. I didn't understand what kind of power, I guess, she has over the water quality people that had already okayed it. I didn't understand how that could happen.
Sure.
Do you understand my question?
Sure.
Probably
Yes.
didn't word it very good.
Yeah, so our sanitarian staff that was presenting the facts of the situation. So you're referring to the variance that occurred in August, because it was heard in front of the hearings officer, and then Lisa did bring her recommendations. And so, Beth, do you want to help talk through how that?
Oh, yeah.
Yeah, so
Yes.
first of all, I'll just say that in the bylaws of the Board of Health, there requires a Board of Health member that has an environmental health background. For this very reason. And so we just are really lucky right now to have Lisa, she works at DEQ, has a really great understanding and background in environmental health and public water supplies. So the fact that she is on the board right now and is at the hearings officer is something that is a great asset, because she has an understanding of the environmental impacts. So I'll start with that. And then that variance was heard in front of Lisa as the hearings officer. And then that recommendation then was brought to the board for consideration. So,
Yes.
yeah.
Madam Chair, members of the board, board member Ellis Mosley. Yes, so I believe what you're speaking to is the water quality piece, that anytime we look at a new or increased source of wastewater to a lot, we're required by state law under what's called non-degradation rules to make sure that that new or increased source of wastewater is not going to further degrade water quality, either to groundwater or surface water. So we have a series of models that we run when we're doing that. So whatever the background water quality is, that new septic system or increased source of wastewater flow cannot degrade it. You can't bring it down to whatever the background is at that site. So the applicant had proposed, this was a replacement system. So there was a house there with an old septic system. The applicant was requesting to not only replace that septic system, but also to add a second living unit to that lot. And so the water quality piece was, I had run the non-degradation calculations to make sure that that would allow that new source of wastewater would be allowed on that site. And so that's what the applicant had proposed, to have that second living unit. Now, as to Lisa's recommendation that the lot only be used to replace what was there for one living unit, I can't really speak to that recommendation. As staff, I presented what the applicant wanted, presented the data, presented the information, and then it was taken, the hearings officer has that option to be able to make those recommendations to the board of what her recommendation is. And then the board votes on whether to ratify or that decision. So I'm a staff, I don't have any influence over what the hearings officer hears and then takes to the board to vote on.
Okay.
Which is why it comes to the full board. So the hearings officer hears the facts, has the discussion, asks the questions, has the discussion with the property owner, makes the recommendations, and then that's why it comes back to the board for
Right.
further discussion and ratification.
Yeah, I understand that. And the process is really good. But they didn't even know where the old system was, and there was no contamination anywhere. She said that.
Yeah,
They did not know where
I think there was an idea where the tank might have been, but the drain field maybe, it was old.
Yeah, it was unpermitted, but there was no contamination anywhere. So I was just wondering why. It was really like starting new. It wasn't really a replacement.
In our eyes, we had a source of wastewater there. It had been being used because someone was living in this old cabin
Okay.
for up until probably about a year ago, using that system. So we would definitely consider that a replacement. But then when if you're going to add that wastewater flow of a second living unit onto it, that's like a new system. right?
Okay.
So, and so that's where we need to run those calculations and make sure we meet the Water Quality Act requirements for non-degradation.
Okay.
Yeah.
Okay, thank you.
Yeah, there's layers of checks and balances and lots of
Mhm.
discussion that should be happening
Mhm.
so that a good decision can be made.
Yeah.
Is there a written findings of fact and conclusions of law that's produced separate from, or is it just this variance criteria notes? Like checklist?
Yes, actually, the one that you all heard last month in September is sitting right here. And it gets produced after the vote happens and then signed by the chair and then myself. And so this is an example, and I can pass this around so you all can see, but the findings of fact is outlined, and then the second document is the variance to the regulation governing, what is this document called again, Beth?
There's
The second one,
variance conditions.
the variance conditions.
There's
Okay.
this, yes,
Yeah,
conditions from
sorry.
the findings of fact and
Yeah.
conclusions of law.
Yeah, so that's what is produced after the board does their business. So after you all hear the, conduct the hearing, hear all the facts and make your decision, these are the documents that then are produced and then put into record and given to the property owner.
Okay, thank you.
Yeah.
And so if they were to appeal to the Department of, to DEQ, this is what they would be appealing from.
Yes.
This written, okay.
Yeah.
This was the one that was done in September.
So this was
Yeah.
the full hearing in front of the board, and we were all virtual for that meeting.
How, does anybody else want to see?
Like,
How is it determined, is it in rule or how is it determined whether or not something is heard by a hearing officer versus the fact finding is conducted in front of the board?
That is outlined as an option in our local regulations.
Right.
So the Lewis and Clark City County Board of Health, back in, when did those regulations?
2020.
2020 got reviewed and updated again. But in our local regulations that the board adopted back in 2020, it outlines both of those as an option. And so typically, Beth or Jay, one of the sanitarians that's working on the variance, they'll say, we have this variance coming. It's probably, they make a recommendation appropriate for a hearings officer. It's pretty straightforward, or it's really complex. I recommend that we just take it to the full board. And so knowing that we can't take every variance to the full board every time, it's just so timely. It's just time consuming. So that's part of the reason why that option was included in the regulations, to have a hearings officer to make board business more efficient. So, yeah.
I think that was kind of getting to my question on your slides. There's a slide, recent variances have included 2 hearing processes. And for me, just kind of thinking through the stage, it's, in my understanding, we usually talk about variances after they've been in front of the hearing officer. But on this slide, it says public hearing at a full board meeting, number 1, and then number 2, public hearing in front of a board appointed hearing officer. And I was just, if you could clarify what.
Absolutely. Last board meeting was a full variance hearing in front of the board. The previous month, there was a hearing in front of the hearings officer.
Okay.
And that was then brought to the board for ratification.
And the decision of how that goes is the staff and the hearing officer kind of on a case by case decide how to do that. Is that what I'm hearing? Okay. That
Staff will
helps.
come to me
Okay.
and we'll bring in Lisa as the hearings
Okay.
officer and make a determination on whether this is going to be, pretty straightforward,
Okay.
pretty typical variance, can use the hearings officer approach versus something that's much more complex and really should just come to the full board for a full hearing at the board.
Okay.
So yeah, if that is determined, that's decided on a case by case basis, depending on the details of the variance.
Okay, thank you.
So this kind of checks all the boxes.
Yeah.
It looks like.
May I add just one more?
Yeah, please do.
Sorry.
Yeah, no, please do.
And the-
Also,
All these.
hearings that are in front of the hearings officer, obviously, any member of the public is welcome to attend, but also as a board member, you're welcome to attend it. If you feel like you want to just be the fly on the wall, you're welcome to always listen in on those hearings officer.
They're open to the
hearings.
public.
They're open. So
They
that's
are-
what I just wanted to.
Yeah.
So it's not like, it's
Yeah.
just in front of the hearings officer and no one gets to hear anything
Yeah.
or,
How would we
Yeah.
know that? How would we know that there was a hearing
Yeah.
going on with the officer?
So it's a legal ad that goes out.
Oh, okay.
But why don't we just make it a practice to just put the information out to the full board so that you
Great.
know that something is being heard in front of the hearings officer, and then that way you have the choice.
It'd be great learning.
Yeah, we do follow
Opportunity.
the public meeting requirements as far as getting it posted in the legal ad run.
Mhm.
But sending that information to the full board can be an added piece of communication that you all get.
Yeah, that'd be awesome. Thank you.
I agree, and I would just like to add I think it would be very helpful for the Board of Health of when we welcome our new members onto the Board of Health. I will just say from, my personal experience in the Board of Health, these hearings are probably what make me the most kind of nervous, or because it's a big deal what we're deciding, and I'm not an environmental health specialist. And so we rely really, really closely on our public health staff to really inform us. And I think, in my experience, this is the first training like this I've had in several years. So I would say that it might be great if Laura, like, when we welcome on new members in September, June, sorry, time is flying, maybe in July
Yeah.
or sometime right away, we offer maybe, what does the board think of an annual, just a brief, like a quick training like this to help us better understand? And I know we get a big giant packet when we join, but
Yeah, there's a
better
lot
know
of
that everybody
information. Yeah.
will pull into that first of all, although this is a huge part of our
Exactly.
responsibilities to protect.
So there was a training a week ago at the commissioner's offices, right, up at the Capitol. There was a board training?
Yes, so the MSU local government office, every year they do a board training, and it's a board in general. So it's really Robert's Rules of Order, how things have to be posted in advance of meetings, how meetings have to be posted and recordings have to be posted. So all the rules that govern boards.
Okay.
So it's a general training for any board within the county infrastructure. So the planning board, for example, or the Parks and Recs board. And the Board of Health is always invited to
Okay. I
listen.
missed it, so I was just wondering what I missed.
And those are annual, provided by the local government, and I'm sure that there are materials that we could get our hands on and send them out.
Okay, great.
Other online discussion or questions from Laura's presentation? Excuse me. Okay, I would just, one more question for you, Laurel or Beth, is, as we think about the fact that we only have so much resources, and we know that prevention is always best, but sometimes we can't prevent, we have to just assume a tank is gonna work, right? We hear it's gonna work, we say install it. Like, is there anything that you guys want us to know as a staff as we make these decisions about, like, what a homeowner could do, or what some community awareness would be around making sure that we as citizens are also responsible for making sure we're protecting our, drinking water sources and our groundwater? Is there something that, because I don't know that it's totally clear always, and I don't have a septic system, so I might just be speaking from like this position, but what would you hope would be the ideal practice from a citizen, that to make sure that, as these tanks are aging, that we're all being good advocates for what we can all do.
I have a
Please.
comment on that. So we were in Arizona and we got a phone call that we had to have our septic tank pumped because the county was requiring it. And we were kind of miffed about it. And then I thought, it's probably a good thing. And then they said, you have to do this every 2 years. We're going to be checking up on you. Well, there was no follow-up after that. I think that was one of the best ideas out there.
Sure.
Honestly.
That's you.
No, it's funny you bring that up.
I know you're sure.
Madam Chair, members of the board.
Thank you.
Section 8 of the Lewis and Clark County on-site wastewater treatment regulations specifically outlines septic system maintenance in Lewis and Clark County. And we have a program already set up to notify residents to regularly report their maintenance activities. That's kind of the bird's eye view of it. After the COVID pandemic, right now it's a little bit on hold because we just don't have the resources to carry out the program. So I would implore the Board of Health to maybe help us as staff find ways to be able to bring that program back to life, if you will. Those regulations have been in existence since 2011. And so it's one of my pet projects that a lot of blood, sweat, and tears went into. And so I would love any opportunity to keep that going. But yes, we used to send people regular notices and letters asking them to report their maintenance through pumping or inspection and send it to the county. There's a lot of moving parts to it, and anyway, that's a whole nother discussion for another day, but that's something that we do have. And so
would a public notice in the paper that just encouraging people to do it? Just
Yeah,
protect
and
their groundwater?
Right. And so we are actually we are kind of in discussions too. We work with our water quality protection district. We're going to be doing a well and septic 101 workshop and things like that for the public, where they can come and learn more about septic and well stuff. We have some things planned around that. But we do need to probably, I would say, definitely up our homeowner awareness model, just to have that regularly in the back of people's minds. So yeah.
There's some really great materials produced at one point, and it's staffing constraints, staffing
Yeah,
limitations.
you said that to us before. So I just had my water tested. I've never had it tested before. I've lived there 17 years. It was all good.
Good,
But
excellent.
our well and our septic are a long ways away. But still, we
Yes.
live out in the country, in
Sure,
the county.
sure. And it's
so
agricultural land around
it
you.
is.
And so you never know your septic could be in good shape and
Now.
distanced from your well, but then agricultural impact to your well is what,
Yeah.
what you're also looking for when you
Yeah.
get your water tested.
Irrigation, all that. Fantastic. Yeah, spraying.
And I'll just say that at the Water Quality Protection District Board meeting on Tuesday, we decided that board would write a letter from that board to recommend considering areas that are better for development and less good for development based on surface water depths.
Yeah.
And I thought that was really great. So I just want to let you know that that's something they're going to pull together and submit to the city and county planning folks, just to kind of weigh in on considering that.
No, that's
I
good.
think that's great too. Okay.
It's all good.
Thank you so much.
you.
That was
Thank
very
you,
helpful. All right, Mary, please update us on WIC. Thank you for your patience.
Yes, thank you for having me. We're gonna have just a drastic change in subjects here. Let's see if I can get this going properly.
Those two guys.
Oh, I should have had them No, I should have had them introduce themselves. That was Nico Hash and Keegan Shay. Thank you very much. They're deputy county attorneys with the Lewis and Clark County Attorney's Office. I asked them to be here in case there were legal questions about the regulations and variances, and it's better for them to answer those questions if they come up. And I wasn't sure, especially after you and I visited about that agenda item earlier this week. I thought, well, I'll just have them come and they can be here for a resource for you. But that's who was
thank you.
remiss in not introducing them, but they are your legal counsel. The county attorney's office is as the Board of Health, your legal counsel. And so they would be the ones to help you through the legalities of the regulations as well as the variance process. They helped Laurel put those documents together to make sure that they were legally sound. And so, yeah, I should have had them introduce themselves.
Thank you.
Afternoon. Madam Chair, members of the boards, I'm Mary Sparks. I am the Child and Family Health Supervisor, which means I supervise WIC and the home visiting programs. And I'm here to share a little bit about what's been going on with WIC in the past year and what's coming up for us. I don't know how we're doing on time, but this probably won't be terribly long, just so everybody knows. Let's see. Oops, I should have introduced who our staff are. They're not obviously here today, but we do have 2 registered dietitians on staff. Maria is our registered dietitian that lives and works remotely in Ohio. And Sherry Winchell is our registered dietitian that's here in the office. Dawn Sullivan is our new clinic coordinator that I think you all met back in August. And then myself, who supervises the program. So for those that are not as familiar with the program, the WIC program aims to safeguard the health of low-income women, infants, and children up to the age of 5 who are at nutritional risk by providing nutritious foods and to supplement diets and information on healthy eating and referrals to healthcare and other resources in the community. We serve, of course, pregnant individuals, postpartum individuals, including women who have experienced pregnancy loss or an infant loss. We also serve parents and guardians of children 0 to 5, so that can be single fathers, that can be grandparents, and foster parents. Income eligibility is required for WIC, and that is updated annually. So in 2024, this is the first year really I have been supervising the program. So I've learned a lot within the last year. I really didn't know a whole lot about WIC, honestly. And so I've learned a lot over the year. And one of the things that I did was I was able to get a test card, a WIC test card, and I shopped as a participant and tried to experience what it's like as a participant for some of our families. And I'm not going to lie, it was not easy. And I think it's good perspective to have that so that we can understand what our participants are going through and give that feedback back to the state, which I did. So we have had some staff changes this year. We had Vivi and Charity, who were our clinic coordinator and our WIC aide and peer breastfeeding counselor, both left the program. The good news is they both got promotions within the department, but it left a program that is normally, excluding me, there's normally 4 people down to just 2 dietitians doing pretty much everything. And so it was a little crazy, little hectic for a while there. At the very same time, we had a change in our database that they use, which was MSpirit, and then it's changed over to a web-based program called SWEB. I don't know what that stands for, to be honest. Anyway, with the staff changes, we have seen a decrease in participation. There's probably more to that story besides just staff changes that have contributed to a decrease in participation. It really has, I pulled some numbers, and it really has been kind of a steady decline since about May. In years past, it's been a pretty standard thing for people to say we serve 800 participants at any time in WIC. And honestly, right now, it's an average over the past year has been 760. And if you look at participation rates since May, May was 758. June was 739, 723 in July, 702 in August, and then back up to 721 in September. So what else could be causing that decline? And we realize that how many participants have been kicked off of Medicaid lately, to be honest. It's been really difficult. Having Medicaid makes a person easily eligible for the program. So they don't have to bring in pay stubs to show that they have income eligibility. When they get kicked off of Medicaid, we then annually have to try to update that information. If they choose not to bring in pay stubs, they fall off of the program. So it is something that is ongoing. I will say, however, when you look at new participants over the past few months, just September was our largest month for new participants at 41 new participants. Whereas if I just glance at the numbers, it's usually somewhere between 20 and 35-ish. So 41 in 1 month was fantastic. We've also started our satellite offices again in Broadwater and Marr counties. Those are satellite offices were closed during COVID, and now we're opening those back up again to give participants an opportunity to go to a local office to get heights and weights and iron checked, so they don't have to come all the way into Helena if they don't want to. I mentioned SWEB is our new online platform. That has been a big transition. It was a lot of prep that we had to do to get ready for that type of change, but it has gone relatively well. And it is an easier, platform to use in some respects and a little bit challenging in others. It is an online program, so that makes it easier to access it when we are doing events or are working remotely. We've also decided to upload some of our forms that are typically mailed out to everyone, including rights and responsibilities, and those are not coming to mind right now, but we have a few forms that we have on our website now where participants are usually, if they have an in-person appointment, they're handed those forms. And then the dietitians can note in the chart that they have received it and they're aware of those things. If a participant is having a remote visit, a phone visit, then those forms have traditionally had to be mailed out to everybody. And as you can imagine, those forms rarely get mailed back. So we don't clearly have documentation that they've been received. So that has helped some in reducing some of our mailing costs and increasing some efficiencies. WIC works very closely with home visiting and is our #1 referral source for home visiting. It really helps those that are experiencing some difficult situations get connected with a home visitor who can help then help families get connected with other resources in their community. We've had some new collaborations this year. I've been a part of the Lead Coalition this year, and the intent of that coalition is to help increase blood lead testing, especially in children under 6. And this year we were able to get a sponsorship from St. Peter's Health to help pay for a blood lead analyzer. And we started offering lead testing within WIC if they would like that testing. It's supposed to be done for people with Medicaid. It's supposed to be done at 12 and 24 months. It is not always. And just because you have Medicaid doesn't mean you're not at risk for having lead poisoning. So We offer that to people in WIC, and then Beth's program offers that to other people in the community as well. We're also collaborating with the immunizations department to ensure that all pregnant women in WIC are offered a syphilis test, because syphilis has been on the rise in Montana and can cause birth defects or a stillborn baby. So we offer that to any pregnant woman, and then our WIC department can just walk them down to the immunizations department, and they can have that test and get the results before they leave. We've also partnered with immunizations and home visiting to be able to offer the following services at Head Start and Early Head Start events. So they had like a back to school, they had a dance, and all families were coming to those things that are participate in Head Start or Early Head Start. So then we created sort of a one-stop shop where people can, if they're there at that event, then they can apply for WIC if they need to. They can get a lead test, which is a requirement for Head Start. They can get information on home visiting. They can have car seats checked and get their immunizations in one little pop-up nonstop shop kind of thing. We continue to have nutrition education with our dietitians. They receive visits every 3 months unless they choose to participate in the WIC Smart online education for a follow-up visit, which they are able to do if they choose. So it makes it a little bit more convenient for families. We do have some new food benefit package changes that are coming in January. They are, it depends on what package you have. If it's a child, if it's an infant, if it's a breastfeeding mom, if it's a pregnant mom. If you're interested in seeing all of the changes, there's a nice comparison between old and new. But in general, the updates make things a little bit more flexible. There's a reduction in how much people can purchase in juice, which we know is a lot of sugar. Gives them more ability to buy fresh fruits and veggies, a reduction in milk, or you can substitute milk products over to yogurt, and then an increase in eggs, or transfer between peanut butter, beans, or eggs. So if anybody's interested, I have that. Yes, question.
Oh, I'm interested in that.
Oh, sure.
Just one.
It kind of goes through all of the different packages, so it depending on.
So I missed the first, I think, slide that you had. What age group does WIC serve?
Pregnancy until age 5.
Okay. Thank you.
Sure.
They want to do that?
We have continued to have participate in the farmers market program, where WIC participants will receive additional money to buy fresh fruits and vegetables from local farmers. And we have traditionally been one of the highest redemption rates in Montana, which we're very proud of, especially with Vivi leaving, Dawn coming on. That was a change of staff, but Dawn has done an awesome job being present at farmers markets and getting that information out to participants and having them redeem those vouchers. We continue to have 2 interns a year, usually in the fall and the spring. Intern from MSU program typically observes Sherry in the office here, and spends the entire week trying to learn everything, which is incredible. And Sherry is awesome because she can talk. Like, that's a lot of talking all day long, but she's great at it. So breastfeeding support, we are struggling a little bit right now because we had Charity leave, who was our peer breastfeeding counselor. We hired Ember, and Ember has since left. So right now we're in a little bit of a state of flux where we're trying to decide how we go forth with that. At this point, it looks like we are, that Dawn is going to take duties from both Ember and herself as just one position. And so we're considering hiring a separate peer breastfeeding counselor. That's a position that is only for current or former WIC participants who have breastfed their children. And it's only 6 hours a week. So it's a very part-time job. So, but if we don't rehire an aide position, then we're probably going to put a job out for a peer breastfeeding counselor, which we've had that job separate before, and it's been up and down whether it's been successful or not. So we're looking at. We do still have pumps available. Dawn is being trained as a certified lactation consultant. So we can loan breast pumps out and give that kind of support to participants. Medicaid also gives breast pumps out, and that has to be accessed first before a participant would access pumps from us. So we do less of that right now. We do also have hand pumps available as if anybody wants them. We have lots available. So as I mentioned, we've been, as far as outreach, we have started again in Broadwater and Marr counties and have had great cooperation with the health departments in those two counties. Let's see if I had it in here, but Dawn and Ember, before she left, have participated in Head Start events in those counties as well to help sign new participants up. I've joined the Kids Nutrition Coalition rather recently. They are really prioritizing getting the word out about WIC and what WIC is. And so I'm excited about that new partnership that I'm forming with them. We were able to, with the two positions that left over the year, we had some savings at the end of the fiscal year. So we were able to purchase some radio ads and digital ads, which are happening right now. We're hopeful that will also help bring up participation. And with home visiting, our home visitors, and with Universal Home Visiting starting up, they are present on the Women and Children's Unit at St. Peter's Hospital for Health. And so they are also promoting WIC as they are there on a regular basis. So we're hiring that Universal Home Visitor within the next few weeks. And so that person will be on the Women and Children's Unit even more regularly than our Parents as Teachers Home Visitors. Yeah, I know. It's very exciting. It's very exciting. St. Peter's Health has been very interested in making this work. And so our home visitors have badges to go as vendors to go and spend time. They have workspace there and can meet with nurses and families on a regular basis. So that's really great to promote WIC and home visiting. What questions can I answer?
I have so many.
Oh, okay.
Surprise, surprise.
Okay.
Do you have milk substitutes that you advocate for?
I should know better. I don't know all the specifics, but yes, sometimes there are some substitutes that can happen. But I honestly don't know what those are right off the top of my head, and I can certainly find that out for you though.
They're all available.
Yeah.
It has to, the registered dietitian has that conversation about allergies.
Oh, good.
And preferences. And then the dietitian then adjusts the benefit package to allow for it. It's not available to families unless the dietitian kind of allows for it in the package. So it's part of that nutrition assessment that happens and the designation by the.
So by saying milk, you mean all forms of milk.
Forms of milk.
Okay, so I'm working with an organization called Amy's Mess, and she's feeding the people that fall in the cracks.
Okay.
That are homeless, they don't have food, they have kids, it's terrible. And her referrals come from the school. So I'll just give an example and you can tell me if they would qualify. Do they have to have a job to qualify?
No, they don't. They have to be under the income limitation for the household. So if it's a mom and a dad in the household, they have to consider everybody's income. but they have to be under it. If they're not working at all, they're under it.
Yeah, so he's a guy with two kids, 2 and 6. And the 2-year-old, she's bringing him meals like 3 times a week, enough to last all week.
Yeah.
Like and he's so shut down and compromised from, stuff that's happened that he's just having a hard time with filling out the applications and getting rejected. And do you have a sheet that outlines, because I'm creating a long list of programs that people can try to qualify for.
Yeah, I
Is
can.
it online? or-
You could go to our website and it'll give you information on WIC and but the easiest thing for him to do is really just call the WIC phone number, which is the 457-457-8912.
Okay.
Phone, that's the main WIC line. And then it's typically Dawn who will answer those calls. She will outline everything that needs to happen. We try really hard to make it as easy as possible. The application just isn't that easy, but Dawn will help walk them through that and make it as easy as we can. I will say that the state is working on an online application. Supposed to be done by next year about this time, which I hope works out, because that would be huge, I think, for
It
people.
would be, and they'd have to have an advocate because these people don't have computers. They don't
Yeah,
even
it has to be
powers
phone friendly, and that's what they're hoping to do,
which
because
is
most
fine.
people have
We're
a
trying to
phone.
find these people and like at least feed them.
So
that kind of
you
thing.
said it's called Amy's Mess,
.org.
and is that here in Helena?
Yeah, she just created a 501(c). She's been doing it for 3 years and she's fed over 4,000 meals.
That's awesome. She might be interested in being part of that Kids Nutrition Coalition. And so if you have information, or I can look it up online and try to get in touch with her, because that's the exact people that are there at the coalition.
And Mary, we have outreach materials upstairs.
Oh,
So Sherry goes like right inside the front door. We have a really nice rack with outreach materials.
Okay, good.
Let's get you some to take to her so that she
Yes.
has them, so she can hand them one of our outreach cards.
Yeah.
To families that
Absolutely.
would,
That's what
with kiddos under 5.
I was just wondering if there's a website or there's something where it has all the programs of these people.
Right there.
This would be it.
That
Oh,
is,
okay, awesome.
Yeah.
That's awesome.
Healthy Mothers, Healthy Babies has worked really hard to put all the early childhood services together.
So that's that HM.
Yeah.
Okay.
And then United Way also has a really nice or it's a little card that they have that has lots of, beyond their early childhood resources, just other community resources that are available. So United Way has done a good job. And then 211 is another resource directory, 211.org or Montana211.org. And then it's a phone call as well to get to local community resources for families. Yes.
Excellent.
So for this dad in particular, he has a 2-year-old. He'd be eligible for parents as teachers. And when a person has a home visitor, that home visitor can help with all of that, because they are there to connect them to other resources,
that's what he needs.
and they see them on a regular basis. And they help fill out applications with people. And so, and there's actually a male home visitor at Florence Crittenton right now that does parents as teachers, if you prefer another male.
Oh, really?
Yeah, so I'm happy to talk to, if you want to give my number, I'm happy to talk to him further about it, or can give you all the information as well.
Yeah, because Amy, she's running out of steam. So she's
Yeah,
getting
oh, yeah,
overloaded.
yeah, when,
Trying to
and
do all this stuff.
she probably doesn't have capacity to help fill out applications
No,
for everything
she
else.
tries. She doesn't.
Yeah.
It's too much.
We
She
need to-
brings snacks to the schools because again, she gets referrals from the schools, from the counselors. And they say these kids aren't eating. So she's trying to get healthy snacks to them, and then they get breakfast and lunch, but usually that's the only 2 meals that they get.
Right.
So she's trying to bring meals to carry them over on the weekends and days off and things like that.
We had the Kids Nutrition Coalition at the new food share building this morning, and it's fantastic. And it is, hopefully he's able to access the new food share, because it's
She went to that and she said it's amazing.
amazing.
I missed, and they have a commercial kitchen. They're gonna start putting together
Yes,
meals.
meals.
which is
Yeah,
really
and
awesome.
the whole experience is much easier because it's just a bigger facility and, it's more like a grocery store. So you're not waiting in a line to get in and that kind of thing. So I think it
Boy,
would,
that old one was so outdated.
yes.
Yeah.
And this one has so much room for them to grow.
Awesome.
So it's
Yeah.
fantastic.
Much more dignified experience.
Yes, exactly. Yeah, for
That's,
sure.
that's really important, actually. A lot of them won't show up
Yeah.
because of that.
Yep. Yeah, it's really nice.
So,
Any other questions? Anyone online? Okay.
Thank you, Mary.
Yeah, thank
Congrats
you.
on the
I
universal.
was gonna say, thanks for applying for WIC and like digging into what people experience.
Yeah,
That's
yeah,
such an
it's
important
just
part. Kind of loops into
it
what
does.
you just said.
something I feel very strongly about because I received a home visitor when my son was little. It was in Part C, which is early intervention, but I know what it's like to need services, to require services. And so I have that kind of background and thought process, but I had never been through WIC, so I had really no idea what I was doing. And when you get when you are a participant, you really have a better perspective, and it, I think, makes people more empathetic and can help drive the way you do. I don't have as much control with WIC because it's very prescriptive, but it at least helps us kind of identify where we could do some things, like putting a few forms online, not expecting people to fill things out and send it back in the mail.
I've always dreamt of having existing WIC families that have figured it out. Like the grocery store experience is really, really burdensome. And so pairing a WIC family that's figured it out with a new WIC family to go to the grocery store together for the first time, I think would go a long way to support families, especially as they're trying to just that first time with the benefits is it's really hard.
Well, I think one thing, just to compliment your presentation, it was awesome. But one thing that I think that is important for the public to know, and also people that might qualify for WIC to know, is that if they qualify, they're not taking away services from anybody else, because it's, what's the kind of entitlement funding? I can't remember. It's the kind of funding where as much as you need, you get. So it's not a limited amount. So as many people that could use it can have it. It's just the numbers that use it, that's the amount of funding. And so if people are like, oh, I'm not that hungry, like somebody else should use it, like we're okay. Like that mindset, I think, is pretty ingrained in the community around, in the nation around WIC use.
Yeah.
It's not just us. And so that was something that's always just like really important, is that it's not taking away from anybody else.
Nationally, only about 50% of people who qualify take advantage of WIC. And in Montana, the last time I looked, which was quite a while ago, it was about 36% of eligible families take advantage of it. So
And we know that
definitely part
nutrition
of it.
during pregnancy in those early years, that's like the most vital time to make sure that pregnant women and those babies are getting the nutrition that they need their little brains are growing, and they need certain types of food, which is what WIC is about. They focus in on the nutrients that are.
That's not the best case scenario, but she's running into people that are doing drugs. They're making their kids stay in a garage and they're living in a camper, and they don't want people coming in, home visitors, because they see what they're doing. They're afraid their kids are going to get taken away, even though their kids would be better off probably. So I think a lot of it.
Home visiting doesn't have to be in the person's home if they choose not to. It can be in somewhere in the community, or even in the office if they choose. So that doesn't have to limit them. Yes, we would like to see the home because of that reason. We'd like to help with the environment. But if they really don't want to, they don't have to.
Okay, that's good to know.
Yeah.
I think that would influence people that need the services.
Yeah,
great.
It is a barrier.
Yeah. Okay. Well, thank you, everybody, for that. Thank you, Mary, for that great discussion. You have more announcements for us. We also are running out of time. Would you like to help prioritize what gets done today?
Yes.
In our limited 15 minutes.
If the board is amicable to the suggestion, and I hate to do this again, but can we move the rest of the effectiveness assessment? We have 3 functional areas yet for you all to discuss. Can
Yeah.
we move that to December? And I'll put it first on the agenda
Mhm.
so that we do it first and make sure that it gets done.
Yeah.
But there are some announcements that I think are really important to say out loud, and then many of them will be followed up by emails from me. But before I started inundating you all with emails, I wanted to at least take a minute to say them out loud to you today. So are we okay with that plan?
Please.
Okay, sorry for it was such good discussion today. So we'll have to learn, I'll have to learn this new board and adjust the agenda accordingly. The first announcement is actually the one that's on your agenda. So Invisible Shield documentary, we have now completed 2 of the episodes. Really great participation, both episode 1 and episode 2. Episode 3 is coming up November 12th. And then January 7th is episode 4. So the third episode, November 12th, is about inoculations. So it's going to be a historical perspective, and then also like what's happening currently. And then episode 4, the fourth and final, is really public health roadmap ahead. So the first episode, we talked a lot about like where public health has come from in the history of the institution. And then that fourth episode will really be like public health now and like where we need to be going into the future. So those are the 2 upcoming episodes, 6:30 to 8:30 at the Myrna Loy. Thank you, Sherry, so much for attending and participating in those discussions.
November 12th one.
Oh, darn.
Is there a way to stream it?
You actually, absolutely. So on the pbs.org website, if you search Invisible Shield, you can get to all 4 episodes.
Oh, good.
Yep, they're available to the public now. Yep.
Good.
Yep, so you don't have to wait.
Yay.
The nice thing is that we're having the discussion. So we're watching the episode together and then having a discussion as a community. So it's been really valuable. It's been really interesting. Good participation, good discussion. So please plan, if you're able, to attend the next 2. Any questions on Invisible Shield? I'm going to just quick like. I didn't think about doing this in advance, but bring up our website and show you updates that we've made to it used to be the COVID hub, and now it is respiratory illness. So it's going to be information that is related to not only COVID, but also, come on. Now I know what Laurel was going through with the, I don't know how to get to, here, public health. And I'll share my screen once I get there. Sorry for those that are online. I'm fumbling. So on our website, we have a whole section for data and publications. And we've had, we have dashboards for a variety of different types of data. One of the dashboards has historically been COVID, but this dashboard has been updated now to reflect more than COVID. It's flu, RSV, and COVID, so it's all respiratory illness. So now that I'm there, let me share my screen so that you all can see. So if you're getting questions from the public about where can information be found, please let them know that there are resources available on our website through this dashboard that's now a respiratory illness dashboard. And so this first tab is vaccine information. It talks about what the vaccine recommendations are and what the ages, and it links to the CDC. The second tab is testing, and this is specific to COVID testing because folks can still receive free COVID tests through covid.gov. And so this gives that information for folks that are wanting the free tests. Otherwise, primary care is testing for everything. So if you go to the doctor sick or urgent care sick, they're going to test for all the things to see what it is that they need to be treating you for. But these are the home tests that you can get free from covid.gov. So that information is still there. And then the data now we link to the DPHHS site because they have updated theirs to include data and information for all 3 respiratory illnesses. And you can get to our county information by going to their website and then clicking specifically on Lewis and Clark County. Then it gives you information about the county. So Lewis and Clark County total shows our population, total cases reported, and it's combined. Unless you want to just look at one or the other, you have the ability to filter for just COVID or just flu, but otherwise it's going to give it to you combined. So 25 total cases reported between the date range that's listed. And it gives you a little bit more information breakdown, but that information is there. And then we continue to do wastewater surveillance. And this has been going on now for several years. And so our data is updated weekly. And there are 2 samples being taken from the East Helena and the Helena wastewater treatment facilities. And weekly, that information is posted for residents of the area to use it as a decision-making tool, really. And that's primarily the reason why we keep it up there. We received feedback from residents that they really like to see this information and they use it to amend their day-to-day activities, especially if they are at high risk of adverse or serious illness from the respiratory illnesses. This is COVID specific right now, but soon we are expanding our wastewater surveillance to also include flu and RSV. So flu A and influenza A and influenza B will all be posted here so that you can see what's happening in our
So what I'm looking at, what we're looking at is in the wastewater.
It is.
The COVID virus is in the wastewater.
It is, yes. So there is, we've been doing this since 2020. And there is methodology where a sample is taken at the wastewater treatment facility and delivered to Carroll College. And Carroll College then does the analysis and is able to detect the virus in the wastewater. And so there are limitations because a lot of folks that live out in the county are on septics, and that's not included in our Helena wastewater system unless folks are working in the Helena area. So there are, I would say that this theory, if you're interested more, if you go to just this main page and the About tab, it will walk you through like how that's done and what it looks like as it moves through the process.
Yeah,
and how the analysis.
How much comes from the vaccine and how much is coming in now?
It's the live virus. Yeah, and so the vaccine is not a live virus. So it's the live virus that they're looking for, that they're extracting and looking for. Yeah.
Yeah, and at least going back a few years, you'd see the wastewater jump up and then our clinical cases would go up.
Mm-hmm.
So the virus is ending up in the wastewater before we're seeing people, because that viral shedding kind of increases as people become symptomatic those first few days.
Yeah.
So is it being killed in the wastewater treatment, or how does that work?
I don't know that I could answer that question necessarily. The virus, the scientists are able to extract and actually find the virus, whether it's alive or not. I don't know. If I read the information again, I might be able to answer your question. Our Carroll College scientists would be able to say, but it doesn't have to be alive to be detected. The DNA is there.
And it's a respiratory transfer. So, it's just, I don't know. Because we won't get sick through our water. I mean,
well,
that was
right. So it could though come from the vaccine, because the vaccine is a killed virus, and you just said it's not necessarily live.
The vaccine's not a killed virus.
The vaccine is a
It's
live
an MR,
virus?
no, it's not a virus at all.
Or
It's the mRNA technology is not virus. It's not like the flu vaccine, where the flu vaccine is it's made differently. COVID is not at all the virus in any way. It's not the
So are
virus.
they testing
alive
for
or dead.
the vaccine coming through into the waste?
No, nope, it's just, nope, we're just looking for the virus itself.
Okay.
Yeah, we just want to, and it's a sentinel, like Dr. Bedell is explaining, it's sentinel. So we've looked at the wastewater as a way to see what's, as a predictor of what we'll see as far as disease burden in the community.
Interesting.
Yeah, it's been really fascinating. And the fact that we get to expand now to include influenza A, B, and RSV, and we'll be able to put that out to the public is really exciting as well. That's coming very soon. Carol's ready to do it.
So you make predictions on what's going to be happening in doctor's offices and clinics and
it's
medications you need to have on, they need to have on hand, all that kind of thing.
It's informative for clinicians. At this point, there's a lot of community members out there that continue to look at it and use it as information for their day-to-day activities.
Really?
Interesting.
Yeah.
Very interesting. I didn't ever know that was available.
Yeah, during when we were making decisions during the pandemic, we were looking at that as one of our criteria of like,
what's happening.
What's
in our
happening. That was really helpful.
Yeah. And it's it's passive surveillance. So we're not asking anybody to do anything. It's just, we all use the toilet. So yeah. But there are limitations to the, what we're seeing as far as, the Helena and the East Helena systems. It's just whoever is using those systems, that's what we're capturing.
Right.
So, which isn't everybody in the county, of course.
Right.
Okay. So I wanted to just bring that to everyone's attention. It is respiratory illness season, and we've made those updates to the dashboard. So I wanted to let you all know that that's happened. Just a couple more items, which will actually be followed up by emails from me. So the first is our State Public Health Association is working on Board of Health training. And they're looking at including a Board of Health track in our annual conference, which happens in April. And so they are putting out a survey asking Board of Health members what you need and what you want. And so before I forwarded that email to you all, I wanted to mention it so that you knew when it came that that's the purpose of it, that they're the association that's working on getting our annual conference put together. They're really dedicated to making sure that there are Board of Health learning sessions available. And because the conference is in Helena, it'll be much easier for you to participate in those. It may be more difficult for Board of Health members from jurisdictions across the state. But I'm hoping that we've not offered that before. It's only been for public health professionals and practitioners for our annual conference. And so I think it's really great that they're including Board of Health, but they're wanting to know from you all what you want to see.
What are the dates for that?
It is the second week in April, the Monday, Tuesday, Wednesday. And without a calendar in front of me, I don't know, but that's right about that 10th, 11th, 12th, or 8th, 9th, something. Right. It's that second week in April.
Okay.
And I believe it'll be held at the Delta Hotel that's just right down the road here. And as those
modules from Missoula that we
I
got.
started, but I haven't finished.
Okay, we were just talking about the trainings that you sent us.
Yeah.
I really want to do it. I haven't had time, but.
Yeah. Yep. And this will be a really great opportunity for board members to learn together. So Bree and I had the opportunity through scholarship to attend the National Board of Health Association conference back in August, and to sit in a room with other Board of Health members from across the country, hearing what their experiences and expertise were, I thought was really beneficial. And so I think that this was prompted out of that. There was several of us from Montana that got to go to that annual conference. So I think they're trying to model a state version of that, so that Board of Health members can sit in the room with other Board of Health members from across the state and learn together. So it's a great opportunity. And then the other email that you will receive from me next week is about the licensed establishment fee increase. So we've kept you all apprised of what that conversation has been up to this point. We are hosting community meetings starting November 6th will be the first community meeting at 10 o'clock at the food share. So they are allowing us to use their meeting room at the food share to host a community meeting. And then we'll do 2 virtual meetings. So 1 in person and 2 virtual, November 19th and December 12th. The November 19th is at 2:30, and then the December 12th, I didn't write down.
9 o'clock.
9 o'clock. The primary audience will be the licensed operators in our county, because we really want to give our licensed operators a heads up, first of all, that this is coming. Give them an opportunity to have discussion and ask questions so that they're not caught off guard when it's presented during the legislative session starting in January. But our local legislators will be invited so that they can also start to hear, understand, and ask questions, be a part of the discussion. And Board of Health members, we're inviting you all to participate if you're able. It'll be 3 of the very same same presentation, 3 different days, 3 different times, knowing that operators, restaurant owners and things like that, they can't get away at breakfast, lunch, or dinner, right? So we want to make sure that we give them plenty of options, different options, virtual and in person. So we will send that invitation to you all as well, so that if you'd like to attend those community discussions about the licensed establishment fee increases, that you can be there as well. So those are a couple of things to look for in your inbox as this week, and then on Monday, we'll send the invitation to the community discussions.
Oh, wow.
Yeah. Anything else you need to tell us?
No, that was my list.
Thank you. What a great full meeting. Okay, any public comment?
Madam Chair, we do not have any attendees at this time.
Well, in that case, we adjourned. Right on time. Way to go.
Great.
Thank you.
Thank you.
Yeah, thank you, everybody. Very informative.